You only take back by yourself. Thank you so much. Now we would like to invite Peachy Luna from Philippine Society. Thank you so much, Peachy Luna from Philippines and Philippine Society and Myanmar Society in in Vietnam. We are good, very good teamwork. You support for us anything, anything. Thank you so much. You always support. We are the keep in touch in good teamwork. Peachy Luna, please. Thank you so much. Peachy Luna, please. You can start share to your webcam. Peachy Luna, you're not yet on microphone. Okay, good. You're on microphone. Peachy Luna, okay. If you cannot, you can off and on again.
Can you hear me?
Yes, here. You can share to your webcam.
Can I start now?
You on camera? You be on camera? Okay.
Yeah.
Yes. But very small, so your software is more small.
Is it okay now?
Yes. You take your microphone. You take your microphone near your mouse. Near your mouse better. You take microphone near your mouse. Microphone. You take microphone. Earphone. You take earphone.
Oh yeah.
You're very small.
Now.
Now, near mouse, near your mouth. A little near. Okay, you can talk.
Yeah. Hello.
Okay, good.
Okay
You
now.
keep. Yes, you keep. Yes. Keep it. Okay, good. Yeah, far, very far. No, close. Yes. Thank you. Thank you. Okay, you can speak.
Can I start now? All right. Good day, everyone. My discussion on the high impact roles and safety of radiologic technologists during COVID-19 pandemic will focus on how RTs are coping and taking initiatives given by the situation in the Philippines. The Philippines confirmed its first case of coronavirus in Metro Manila and the entire country on January 30, and the first coronavirus-related death outside China was recorded in Manila on February 2. The first case of community transmission was reported by the Department of Health on March 6, and on March 8, President Duterte declared a state of public health emergency. On March 10, the President ordered the closure of all the schools, colleges, and universities in Metro Manila, and on the 16th, the President declared a state of calamity throughout the Philippines due to COVID-19 and imposed an enhanced community quarantine covering the entire Luzon, including Metro Manila. The Department of Health reported that the total number of coronavirus cases in the Philippines has reached 12,091. Though the DOH recording more or less 200 new cases each day, there is increasing number of new recoveries, bringing the tally to more than 2,460. Most cases with more than 60% are coming from the National Capital Region. The DOH also confirmed that the new number of healthcare workers have contracted the virus, bringing the total number of infected to 2,165 and now account 18% of the total COVID-19 cases. Despite the increase, the DOH maintained that the rate of infection among health workers continues to follow a downward trend since its peak on April 10. Also, there is increasing number of health workers who have recovered and no record of deaths for a couple of days now. With over 2,000 infected healthcare workers who have contracted COVID-19, the 5 medical professions with the highest number of cases includes the radiology technology with 42 and ranked 5th. The World Health Organization expressed concern over the high COVID incidence among the country's medical frontliners and said that it's coordinating with the Department of Health to look into the possible causes. According to Dr. Abu Muhammad, the WHO Western Pacific Region COVID-19 Incident Manager, the alarming development may be due to the lack of personal protective gear, its improper use, or increasing number of cases overwhelming the healthcare system. And to augment the workforce in health facilities in the regions, provinces, and cities that manage COVID-19 cases, the DOH has hired 1,237 personnel in 19 hospitals and quarantine facilities. Of these total number of hired personnel, about 49 are radiologic technologists. And as of May 11, there are still 77 facilities have requested for additional healthcare workers under the DOH emergency hiring program. And to ensure that the workforce in healthcare facilities in the regions, provinces, and cities that manage COVID-19 is sufficient, the government has suspended temporarily the overseas deployment of healthcare workers. And likewise, the POEA temporarily suspended negotiations of government to government hiring of Filipino workers. And among those temporarily barred from leaving the country are X-ray and radiology technologists. The high impact roles for safety shielding. There has been an extraordinary demand, as we know, for personal protective equipment with the rapid spread of the novel coronavirus, SARS-CoV-2. You can imagine a situation like when everybody needs PPE immediately at the same time while leaving some resource-challenged areas and facilities without adequate supply and access to PPE. A news featured how an improvised PPE face mask is worn by a radiologic technologist during rounds at the district hospital. The Filipino radiologic technologist said that PPE stocks are in very limited supply, so the hospital could only issue RTs 2 sets of PPE. However, this rad tech at the hospital found a way to supplement this supply. He used some spoiled X-ray films with emulsion stripped off, packing material, elastic, and glue gun to make his own face mask. And some staffs also are using raincoats so they can sanitize and reuse as an added protective equipment. Determined along with institutional guidelines, resource availability, the conservation of PPEs and other materials is taken into consideration. Some RadTechs now wear different design PPEs manufactured by local garment factories, and one hospital was even featured in a news to have its own staffs suing their designed PPEs to augment their supply. And in March, healthcare professionals sounded alarm over this shortage of protective gear, and this pushed volunteer groups and associations, including overseas Filipino RadTechs, to donate PPEs and improvised equipment to frontliners. And even donation of food, along with other PPEs and disinfectants, are supported to the frontliners by our chapters. And until this time, there has been continuous efforts of our chapters to deliver donations and supports to RadTechs and other frontliners. There are also initiatives of many COVID centers in the Philippines, like the University of the Philippines General Hospital. They developed strategies on how to conserve PPEs, and one strategy is earning the commitment of healthcare workers. This is need to conserve PPEs being emphasized to all the staff, including the radiologic technologists, during their orientation and training for donning and doffing of PPEs. Distancing. Radiology department's preparedness during this outbreak included enactment of policies and procedures that allow continued operation during an extreme healthcare emergency. assist in the care of patients with COVID-19, and maintain radiology support for the entirety of the hospital and the health system, including elective imaging or postponement of non-urgent outpatient imaging, accepting only patients within the capacity of the radiology, dedicating machines. Specific machines are assigned for imaging suspect, probable, and COVID-19 patients. Isolating exposure area means limiting of movements and access of other staff in the exposure area, and no other patient should be within the examination areas or adjacent corridor or space at any time. Doing portable exams when possible. Patient is imaged with portable equipment in patient room or in isolation. And of course, distancing. RadTech distance himself to staff and patients as possible. The RadTech also allows the nurse or staff in full PPE to assist in the procedure, prohibit accompanying visitors except in cases where a single member of the family or a caregiver is needed for patient's ambulation, understanding, and or cooperation in the examination. In here, the RadTechs played major roles in the strict adherence and implementation of guidelines that includes giving awareness of the new protocols to all the members of the healthcare team in the hospital and also relatives of patients in some cases. And finally, time consideration. All these roles that relate to time reduce equipment cleaning time, PPE use, and potentially exposures to infection. The roles include that all radiology technologists must be decked to render the service except those who are pregnant and immunocompromised, including senior citizens. And the artists take the initiative to sanitize the workspaces, tables, surfaces that are frequently touched at every regular 6 hours with disinfectant supplied by the hospital, and also diligent in wearing, removal, and disposal of the PPEs. Also is the thorough hand washing, bathing, and complete disinfection. Procedures also may be done only during a designated schedule by the department and or after all the scheduled patients of the day. And all efforts are being made to shorten the time in the radiology and the number of visits to the radiology. And also the structured schedule for the staff to provide them with longer periods of day off, allowing the staff members to stay vigilant and observe themselves for symptoms of disease. In closing, in these unusual times, it is more important than ever that the radiology community, the RadTechs, work together so we heal as one. Thank you very much for your attention. Acknowledgements to all the RadTechs who have given their contribution for the completion of this report. Thank you.
Thank you so much, Peachy Lunar. Please send our thanks to President Bangladesh and all participants in Philippines. Thank you so much, Peachy Lunar again. Yet let keep interest in good team. Yes, thank you so much. Next